Aortic aneurysms are a weakening in the wall of the largest blood vessel of the body, and this blood vessel runs from the heart through the chest to the belly and down to the legs. And it's about the size of a garden hose. So when pressure develops in this weakening of this hose, of this blood vessel, it expands much like a balloon expands, and as it expands it can rupture. And this is actually one of the leading causes of death within the United States, a rupture of an aortic aneurysm. Patients usually find these aneurysms incidentally. That is, they're getting a test for something else like kidney stones or stomach pain or chest pain, and they undergo a CAT scan or an ultrasound which finds an aneurysm. And then some patients come because they've had screening for the aneurysm itself. And many people at the age of 65 undergo this screening with a simple ultrasound that can be done in any physician's office. The best way to prevent death from a ruptured aneurysm is to fix it before it ruptures. And we do this in one of two ways. We either do it with a surgical procedure where we actually open the belly and replace the aneurysm with a piece of graft, or we use what's called a stent graft, which is a minimally invasive procedure where we go in with an x-ray machine and go in through the arteries of the leg to assemble this device. Now this looks like basically a wire mesh cage around which a piece of fabric is wrapped. And these are inserted with instruments, with long instruments through the legs, and they go into the graft itself. And what it does is it creates a new lining of the artery in order to prevent pressure from going to the aneurysms. This is usually done at the hospital. It requires about 2 days of hospitalization. Most of the patients, they can go back to their normal activities within a week or so after the procedure. It's done with relatively low risk. And the patients return to us and they undergo monitoring for the device for the rest of their lives.